Hi, my name is Sneha. Today we're going to talk about response interruption and redirection. What is response interruption and redirection? It is an evidence-based practice used to address and decrease interfering behaviors that are repetitive. RIR is useful with behaviors that occur in the absence of other individuals in a number of different settings and during a variety of activities. The logical basis of RIR is by introducing a prompt or other distractors when the problem behavior is occurring. RIR is used after the completion of a functional behavior assessment, as FBA determines the function of an interfering behavior. RIR is used with other evidence-based practices, including reinforcement, differential reinforcement, and prompting, where RIR is in addition to reinforcement when reinforcement alone is not effective in reducing the behavior. Evidence base for response interruption and redirection. It meets the evidence-based criteria with 10 single-subject design studies. All evidence-based studies were mainly conducted in clinical setting or in one-to-one sessions with the learner. Studies show that effectiveness of RIR with elementary, middle, and high school learners with ASD ranged from 3 to 21 years. Response interruption is where teachers stop the learner from engaging in interfering behavior. This is done by verbally or physically blocking the learner's effort to engage in a repetitive behavior. Whereas redirection is the second component of the intervention, which mainly focuses on prompting the learner to engage in a more appropriate alternative behavior. These two components will be explained further in the presentation, along with additional steps that are needed to use RIR effectively. RIR involves 4 steps for implementation. Step 1. Identifying the interfering behavior. Practitioners identify an interfering behavior that they would like to decrease. Practitioners complete a functional behavior assessment to identify the possible functions of the behavior, when the behavior is occurring, and what time of the day. Based on which, practitioners would develop a hypothesis statement for the behavior that includes the setting events and the functions of the behavior. Step 2. Collecting baseline data. Once the target behavior is recognized, practitioners collect baseline data to determine how often the learner is currently engaging in that behavior. Data is also collected on how often is the learner using the alternative behavior. So it is important to know that baseline data gives a starting point from which practitioners can evaluate whether the behavior is going to decrease as a result of RIR. Step 3. Implementing response interruption and redirection using the components of the intervention. This is where the learner is praised for independent use of appropriate skills, and when the learner starts to display interfering behavior, practitioners interrupt the learner's attempt by using verbal blocking or physical blocking. For example, the vocal stereotypy can be interrupted by providing a demand that involves a response that is based on vocalizations. Hence, it makes the learner display appropriate verbal behavior while no longer engaging in an incompatible behavior. Step 4. Monitoring learner's progress. This is the step where data is monitored to evaluate if the interfering behavior is decreasing as a result of the intervention. Learners' use of alternative behavior is evaluated in a setting or the activities where interfering behavior usually occurs. Based on the monitoring data, adjustments in intervention are made if the interfering behavior is not decreasing. The implementation checklist for RIR. Response interruption and redirection can be used by a variety of professionals, including teachers, special educators, therapists, and paraprofessionals in education and community-based environment. And stereotypy is not a bad thing. Even typically developing individuals engage in stereotypic behavior. It is a concern only when it interferes with learning that are identified as significant to the individual. Training parents on response interruption and redirection. You provide parent a written checklist or a routine for how to implement RIR. You model the use of RIR for the parents directly with the child who displays the behavior. And then you provide an opportunity for the parent to practice using RIR with their child while you are observing, and then provide feedback on their use of RIR. Overall conclusion: Response interruption and redirection is profitable to individuals with ASD in many different ways. This intervention provides opportunities to respond with appropriate vocalization. So through implementation of RAR, more opportunities will be provided to the learners to vocally express appropriate behavior. Response interruption and redirection intervention allows teachers to take account of students' interest when implementing the strategy. RAR is possibly an effective strategy that meets the requirements when dealing with vocal stereotypy. And it not only serves as an intervention that in which decreased inappropriate verbal stereotypy, but also provides a variety of different positive outcomes through the unique nature of intervention strategy. Thank you for watching, and I hope the video gave you an understanding about what is response interruption redirection and how is it used in the field.